So we're increasingly recognising that chronic pain is a problem in sickle cell disease, and that as people are living longer with the condition and the medical care is getting better, the chronic complications are increasing, and one of those complications is chronic pain. And it's really hard to get an estimate of how common chronic pain is in sickle cell disease. But if we look at some of the research that's coming out from America, some of the authors there are suggesting that up to 50% of people can have pain in between crises. And so that's a really significant proportion of our sickle cell population living in the UK. Chronic pain in sickle cell disease, we use the definition of pain that's been around for 3 months or more. And sometimes in sickle cell disease, we see that as associated with a specific condition. So that might be because somebody has avascular necrosis or because they have leg ulcers. But increasingly, we're noticing that people are experiencing chronic pain without any obvious cause for it. And this is something that we see in other pain conditions really frequently, that chronic pain can be associated without any obvious signs of tissue damage or difficulty, that we see chronic pain in the absence of any of those symptoms. It can be really difficult for people with sickle cell to access pain management programs in the UK. So for people with other types of pain other than sickle cell disease, actually access to pain management programs and pain services is relatively good, but that's something that's really tricky for sickle cell disease. Part of that is about some of the services might have sickle cell disease as an explicit exclusion criteria. Some of that is about the fact that historically haematologists are not necessarily having good links with pain services and don't know about referral pathways, but also sometimes it's about the patients and feeling that a group-based program, if they're the only person with sickle cell disease, they can actually feel quite different, and it can be really hard for them to engage in a group process and feel that the ideas discussed are relevant to them. I think chronic pain in sickle cell disease can have quite a devastating impact on people's lives. I think for a lot of people, when the pain is there all day, every day, and it makes movement really difficult, it can affect their ability to do the things that make life meaningful. It can make it hard for them to work, which can bring financial difficulties, and it also can affect their mood, their ability to engage in hobbies and activities that they do. And it's really easy for these impacts to spiral and for the person to feel really overwhelmed with the difficulties and not really know where to start in making changes.